Leading a state or local government agency in the U.S., but finding it hard to get rid of operational and technological inefficiencies? You don't need to look any further because help is here. Welcome to Rethink IT with Abhijit Verekar, a podcast dedicated to helping municipal leaders, city and county managers, mayors, CIOs, city or county council members, and others rethink IT and make government more efficient.
Hey guys, welcome to today's show. I'm here with my buddy, my partner, Mike Caffrey. We're going to be talking about something that we've been dealing with a lot. In fact, I was on a phone call with a public housing authority a couple of hours ago and talking about how do you spend CARES dollars and how do you make sure it's kosher to spend those dollars on a certain project. We've been dealing with this for almost a year now, but we have some fresh thoughts on how do you even go about thinking about what is a COVID-ready, shovel-ready project, and how do you go about matching dollars to projects. So, Mike, I know you've been in the thick of things as far as that all is concerned. So what do you think are the few things that we should be talking about here as far as being COVID ready? I mean, I don't think anyone wants to hear that term anymore. It's just, we're all sick of it, but
No, you're right.
We have to deal with it.
We have to deal with it. And one of the things I think we'd all agree on is that this necessity has driven a lot of change, and most of it is really good change. I think what's different though is you and I have seen firsthand that there are some agencies, counties, cities that have been great at asking for money. And there are some that seem to have missed the boat entirely, right? And I think we'd all agree also that the need is consistent everywhere. There isn't pockets of need. There's need everywhere. So when we look at this either localized ecosystem or nationwide, why is it that some agencies, some governments have a lot of funding to do a lot of different things, and others are still struggling to figure out what it is they want and how to pay for it?
Right.
I think that's an interesting puzzle to solve, right? And one that we usually aren't involved in, right?
Yeah. Well, and I don't mean to be flippant when I say we're sick of it. A lot of people have died. A lot of business has been disrupted. Thankfully, we're in a business and in a region that handle things slightly differently than a lot of the country. But the CARES deadlines have been extended for cities, counties, local governments that got CARES funding in 2020. At first, there was this rush to spend because the deadline was December 31st or something like that.
Yeah.
And then they said if you have unspent funds, you can now spend it all the way through to December 31st of 2021. However, I don't think they've said you can spend it on any and everything. There's still some parameters.
Yes.
But tell me about your experience when you were dealing with our clients, and this one particular client said, help me become more COVID resilient, and we're going to use CARES dollars. What were some things that you encountered? Meaning, I know you talked to the state in the state of Tennessee was the one dispersing the funds for this county client of ours. What was the conversation you had with them?
So in the beginning, you had to have something that was, they called it shovel ready. In other words, the timelines were such in the very beginning that if you didn't already have this thing already outlined, already architected, whatever it is, and it didn't fit within the rules, but it could not have been budgeted for, in your last fiscal budget cycle, right? Number one, it wasn't going to get funded. And number two, it wasn't going to complete in time for you to get reimbursed. So, so those of us that had that were agile enough to find something that could benefit, could provide for the greater good for the communities we were in, and also gather the resources as quickly as possible. We were ready to go. But then, as you pointed out, here we are coming up on the end of 2020 in December, and then we find out the deadlines have been extended. Something I don't think anybody expected in October. Right. And now it's like extended for what? For the project that I was supposed to finish by December 15th? Or could I identify new projects and use the new deadline of 12/31 of 21? And I think it's the latter. That there's, as you pointed out, still rules around the kinds of projects that you might attack. But to that end, we got a much longer time frame to not just ask for the money, design a solution, implement, right? Do things in a proper fashion as opposed to knee-jerk, which is the way I felt 2020 went.
Yeah. So when you said shovel ready, when we pitch projects to our clients, or they come to us and say, hey, can you do this, that, and the other, after you do the technical design and the scope of work and all of that, you still have to go through a fairly significant purchasing process, right? If like, for example, one of our clients got $10.5 million to spend between, I want to say, May and December of 2020. By the time they found us, by the time we had those discussions, by the time we were ready to take this to purchasing, they were now purchasing, of course, they're doing their jobs. They were saying, okay, we need to put this out to bid. Here's the timeline. We're going to sink 2 months into the purchasing process. How did you get over or around it? Were there special provisions that Tennessee provided their counties that said you don't have to follow certain purchasing rules because this is, emergency spending?
That's probably the best point of this whole conversation, is that nobody wants to hear that we bent the rules, we went around the rules, we used other rules, or we didn't follow the rules. We use the same rules and protocols that we would had these been normal times. Right. It forced us to be more creative. So we would, if we found a solution, we would look for other counties that had an active bid that could add us to that bid, and then we could use that vendor with that solution at a predefined discount from another county and bring that to bear in the city or county that we were architecting a solution for. It shortened the timeline, but to your point, also, this is usually a months-long process, and we had to compress that into weeks. So it not just finding a solution, but finding an acceptable solution, not just hey, this is just good enough, but everybody wants what's best for their community, right? So finding that best solution and then scouring the neighboring counties and cities, bids, state, federal, whatever that purchasing agent was capable of utilizing, and then going back to that community, that purchasing department, and asking them if we could be added to that bid, and of course, people are always so kind to do so, and then from there, getting all of that back to the purchasing department that wants to move forward as quickly as possible, so they can take advantage of this great opportunity presented to us here. So, there was a lot of activity and a very short, and that's just the funding part. We haven't even started the work, right?
Right, and you're not talking about just buying computers.
Right.
or HVAC systems. That was a hot topic, right?
And it's a hot item, right?
Hot item, HVACs, COVID killing lights.
Yes.
You name it. Rightfully so. I mean, those things have direct impact. But as far as technology projects go, people were buying computers, of course.
Yes.
Because you want to make sure your staff is mobile ready to go work from anywhere,
right.
that your infrastructure is ready. But then we did some novel projects, right? The CBRS pilot for Blount County. We used an almost empty mall for Wi-Fi zones where children could come and do homework if they don't have access to internet at home. Just a couple of examples. So it seems like we have some lessons learned from the last round, if you may, of CARES funding. So the first thing is have a list of shovel-ready projects, right? I mean, we have the second, third round of funding now with some different regulations, but we're in the same boat. If you don't have, if you haven't thought ahead about what are you going to do to make life better for your staff, for the citizens, for school children, and have a list of projects ready, you're going to sink 2 or 3 months into your deadline, not having anything done. So I think it's important to have, maybe the first project is a strategic planning project where you think about what's possible. What do you want to get done in this 1 year? What was on your list maybe to do 3 years from now, but let's get it done now. So I would say step one is have a list. Sometimes call it your pie in the sky list. Let's see what we want to do.
Absolutely.
What's possible.
But live in the words you just shared, right? In other words, don't come at me with a list saying, I need 33 of, Dell model 3322 laptops, right? That's not what we're talking about here, right? Come at me with, here's some things we want to accomplish. In other words, define the outcome that you're looking for, something you're looking to achieve within your community. And then let's have that refined discussion of, so how do we accomplish that? What kinds of technologies can you bring to bear? How much do these things cost, or should they cost? What would be the effort to make that, to implement that thing? And what should fall out from that conversation is, here are 5 or 6 projects that can be completed within the time frame allotted, right? And here's a couple that we'd love to do that just aren't going to fit, because it still has to fit within the guidelines provided for 2021 CRF funding, right? But if you were to have that conversation that you just described, and it's not a technical one, it's more about the outcomes, I think then you're more likely to arrive at something that truly benefits the community. And if in the end it still ends up being 33 Dell laptops, then so be it. That's what it needed to be, if that's one of your top 5 priorities. But if it isn't, if it's something like, we need to add a portal so that we can do more contactless permitting within the community, so people can do more online instead of coming into the office, so people can make more payments with credit cards instead of checks and cash. I mean, those are great outcomes also, right? And unfortunately with small gov, those things, because some folks might be laughing right now saying, yeah, we did that 10 years ago. There are still communities that have not done that. And those need to be brought to the forefront. And those projects need to be maybe on their top 5 priority list. But yeah, I'm all for defining these outcomes, not with techie words and vendors, but with a true non-technical approach that says, here's what we want to do within this community, and therefore here's what we need to do, allowing us to get as creative as we need to be to make that happen.
Okay, so once you have those outcomes defined, Mike, what do you think the next step is? Of course, you shouldn't assume
we are guilty of this too. Like last year, we had solutions planned, for example, for virtualizing courtrooms.
Right.
We said solution can be done. Here are the components.
Right.
We didn't factor in that our vendors like Dell were struggling to find components at the time because everyone's looking for it.
Right.
What are some things that you should assume or shouldn't assume when you do have that list and starting to plan for rollout?
So under the category of do not assume, even with this compressed time frame, to get a project done, and knowing that we may not have had something truly shovel ready, I think the assumption there is we can't prototype, we can't test a solution. We have to go all in with the answer, the solution, and it's going to cost X. The thing I think that if we were to take a more iterative approach would be for us to come in and say, there's something we can do now, and we can improve upon that over a period of time, and it would still fit within guideline. That they're some of the best things I've seen from a creative team is for people to play off of another's ideas. So we start with maybe that department head or project sponsor, and we put something in that they find acceptable. We make tweaks along the way to improve the performance, or if they like the performance, to expand that technology to put it in other areas. But we didn't go at this as let's make the perfect design, and in 3 months, we'll do a massive big bang implementation. We bit it off in little bits and pieces along the way. And frankly, as we got towards the end of the calendar year, we knew also that if we were to do this in that fashion, that maybe we don't finish with what the final vision is, but whatever this interim vision is, it will be good enough and get paid.
So you're talking about assumptions, right?
Right.
When you make assumptions, we have to be careful in how you communicate those between our team, also our clients, their teams, and the user base. There's an element of change management that comes in through all of this planning. And again, we're talking about moving at breakneck speeds.
Yeah.
When it comes to government, especially, right? If it was private sector, as you know, better than anyone, we would have pivoted so quickly.
Yeah.
But the challenge that COVID has exposed or highlighted is, governments are slow to begin with because, by design.
Yeah.
You don't want to move fast and break things. You want to be deliberate and be stewards of the taxpayers' money and expectations and outcomes. So when you have a plan, when you define assumptions, when you found the money, you have to have a change management process so that your user base understand what's to come and what to expect. How do you deal with that?
Yeah. So again, when you look at things you assume, right? Our assumption is we're going to run as fast as their client or project sponsor allows, right? As fast as they want. But in this case, because you're right, it's not in their DNA to run quick, right? And for good reasons. But the communication piece is left unchecked, right? Mm-hmm. So we're dealing with somebody that, I don't have a shovel ready. Help me find a way to get this thing implemented and help me find the funding to get it done. We're doing all of that for them. And then we find we get to maybe the first iteration, phase one, and somebody's not happy. But somebody's not happy for the reason you think. They're not happy because of the solution. They're happy because they weren't included in the process of the design. They weren't included as a checkpoint during tests. Things that typically would have happened in a technology solution that we didn't have time to do. We were looking for our client to lead us, through that. And as a result, there's potential for feelings to get hurt. At the same time, there was so much on the line here, not just the funding, but the technology had to work, right? And I'd like to think that we all had our eye on that there's a net benefit to the community, right? That somehow by implementing this project, we've made things a little bit safer, a little bit better socially distanced, and even a lot more efficient in many cases than it was before. But not everybody got to be included in those decisions, and it's unfortunate, but that's one of the things we saw. Didn't have to happen that way.
Right.
Just happened, right? So now that you're looking at a longer timeline to get these things done, I would go out of my way to make sure that if people aren't to be included in the process of design, that at least they're included from a communication point of view, so we acknowledge the fact that they're there. They're not going to make it perfect, right? But we still got to move quicker than we would have typically, right?
Yeah, and the good news is if our clients or prospects still have money left from the last time, you've got a year now to spend it to do this right.
To do it right.
To do it right. So prioritize list, good assumptions, clear communication between all parties, and don't forget the small things, right? Like another lesson learned from last 6 months is, we were able to make our clients more resilient to remote work by being more secure. We moved desktops to their houses. We made sure that they have the right kind of internet. The non-technical things sometimes get forgotten, right?
Absolutely.
Who's going to go check mail every?
Yeah. And it seems, that, I mean, I'm sure there's somebody, laughing at that comment, but that when you look at the process piece, the third leg of a three-legged stool here, the thinking tends to move to, I just need some piece parts here, guys. Help me buy some piece parts, and then I can work remote, and then this will be better. And then in 4 months, when the pandemic is over, I can go back to doing things the way I used to. We heard that a lot early on, right? And here we are sitting almost a year later, and not only has nothing changed, but we could be on the verge of yet another wave. And what have we done to protect ourselves? Yeah. Right? Yeah. So I think that we need to be more aware of what's going on around us. I'd go even a little bit further. Let's say that to fit guideline, to make sure that we got most of our goals accomplished in a shovel-ready project for 2020. I think now would be a great time to go back and refine some of these things. Maybe I didn't go through that process of going, having a strategic planning session. Let's invest a little bit of time in that right now, right? Before we go into the budget cycle, before we spend more money, perhaps in the wrong area. Let's have one of those sessions now. Let's collect some input from people that might not have had a say in how things ended up as of here in January of 2021. And then from there, maybe adjust our plan a little bit, or go back to some of these things that were implemented and make them run a little bit better than they did when we finished them, in last December. There's a lot of room for improvement. I think we'd all agree in that. It's when do we make the time to prioritize what those improvements need to be. And then we can go through the same process again of, can I find a useful bid without going through the RFP process? And can I find money still that can be useful in helping us achieve those goals? All of these things are doable, right?
Yeah, and it's a great time, like you said, right? We're about to start budget season.
Yeah. Your favorite time of year.
My favorite time of year. I don't like sleep anyway.
Sleep is way overrated.
Right. So budget season coupled with what seems like a lot of money, right?
Yeah.
We talk about public housing authorities. I think there's 73 or 78 billion dollars made available. Of course, not everything for technology and planning and blah blah, but there's a lot of money available. You're in the right timing.
Yes.
And especially for our public housing clients, right? They're probably, if there is another wave that is worse, they're probably going to get hit harder because they have to provide services to people that can't afford housing in a pandemic. So rightfully, they have a lot of funding available to them. It's a great time to start thinking about these things. And we threw around this term, the new normal, last year. Everyone did. We're guilty of that too. But we're starting to find out that there isn't such a thing, is there?
Right.
You have to stay on top of things and evolve until you find whatever that new normal is. I think the process of finding it is what we are all going through now.
It's a conversation you and I had not quite a year ago. Was more like the kind a lot of folks might be having about a year ago, which is, what is this thing and how do we deal with it? But one of the things that struck a chord with me in one of our conversations, AV, was when you look at what you just brought up, public housing, when you look at those less fortunate, this gap that we live in, this period here where some of us have lots of options for education, for healthcare, for providing for our families, have access to even just news as to what do I need to do to either protect my family or to protect the things that I feel are most important, education for one.
Right.
Those are simple answers for guys like you and I, right? Firmly planted in this middle class here where, I've got internet. Doesn't everybody? Mm-hmm. Right. And my doc is, just down the road. Great guy. I can see him anytime I want. Doesn't everybody have access to docs like that? You and I have driven by clinics where just for COVID testing, that urgent care clinic had a line around the block, a socially distanced line, but a line nonetheless, right?
Yeah.
These are all things that I think while we all looked inwardly a year ago or almost a year ago, we all focused on ourselves. And at that same time, what we're seeing, as you brought up the public housing segment here, is we saw ourselves, but we missed seeing what we could have done for others. And this is a great time, I think, for all of us to be bigger than ourselves, to reach out and look for those projects that don't just make an efficiency for a government, but to extend government to make sure that those less fortunate have access, the same kind of access as the rest of us. And it's a segment too easily ignored, especially if you're in a rural setting, which is what, 85% of America, right?
Yeah, and I know you're extremely passionate about this particular thing, right? So we've done some projects. Of course, a lot of 2020 or mid 2020 through the end was making sure our clients are secure. Because when you're not in the courthouse or the housing authority main office, a lot of things you do on premise can get undone.
Right.
When you're remote, when most of your workforce is remote and your network isn't built for that, there was a lot of the sort of fundamental basic block building type projects we did.
Right.
And then we also did things like we hooked up a whole campus, a college campus, with fiber.
Yeah.
That was COVID funding.
Yeah.
They went, what was it, 1800s they built that campus?
Oh, yeah. Yeah. Over 100-year-old school campus. And, obviously presents a lot of there's a lot of hurdles when you're dealing with buildings made of stone and not cinder block, made of, I don't even plaster and not drywall. I mean, interesting, but I think is a great example of here's a point in time where you see a lot of colleges going virtual, right? And thinking maybe this is the new normal for them. And here's a college that is preparing for whenever this thing subsides, right? That there'll be a better connected version of themselves and using the money, I think, in the right way to extend themselves. I mean, after this pandemic, there's going to be a lot of folks that might be looking for a path out of severely impacted sectors of the economy, right? So if you were in a service sector and you were negatively impacted by COVID, and you've seen this now going on for the better part of a year, and who knows when it ends, maybe your thinking is I need to go back to school. Well, you're going to need to find a school that can cater to a distance learner, right?
Right.
And it has to be connected to do that. There's a lot of old college campuses, I'm afraid, that are they're eventually going to either be consolidated or fall by the wayside because they weren't prepared for what just hit them, right?
Yeah.
In the same way that we've seen with small businesses as well. We'd like to think that government is a bit more resilient in that regard, but it's not, is it? I mean, vulnerable still, and certainly in other states where maybe their tax revenues are tied to service industries or communities where maybe a large part is dependent on vacation revenue, for example. What are those guys going to do? Right? How are they going to pay the bills?
Well, in that the connecting fiber into an old large campus is a good example of a shovel-ready project, right? Yeah. To bring it to step number one, what have you been planning to do or wanting to do that's ready to go with minimal planning? And that was a good one. And then when we did the CBRS pilot, it wasn't. I mean, the COVID and the pandemic was a trigger, but there's always been this push for bridging the digital divide. That existed before pandemic,
Absolutely.
And that will exist unless we do something about it.
Yeah, it'll get bigger unless we do something about it, right?
Yeah.
And again, when you look at the things we have and the things that others don't have, it's easy again to assume that we all have access to internet. And I know a couple of years back, AV, you and I were talking about, the fourth utility. So we got water, we got power, we got sewer, but the fourth utility, is it internet or data? However you quantify that, right? It is becoming a necessity of life, and the pandemic has underscored that, right? That what am I going to do? My education is dependent on that. My healthcare. In a lot of communities, guess what happened in the last 10 years? Regional hospitals have been either shut down or consolidated into bigger hospital systems elsewhere. So that hospital that used to be in your hometown, you now got to drive 45 minutes to get there so you can stand in the line, socially distance, in the cold. These things have happened, and now the pandemic have made the differences between the haves and the have-nots even greater. The digital divide, as you pointed out, if people do not see what the pandemic has created, all they need to do is hop in their car and drive down to rural America, Main Street, USA, get out of LA and New York, drive anywhere else, and they're going to see communities without the full range of services that a lot of us take for granted. Yeah. And a lot of it driven by what? The ability to get data from point A to point B. telehealth, telemed, right? What's going to happen in some rural community in Nebraska? Do they have telemed, right?
Legal services.
Yeah,
right?
there you go.
We did work for a legal services agency in Nebraska last year.
Right.
Their whole it's legal aid. It's not it's a fairly large organization.
Right.
And in Nebraska, it's one legal aid that's supposed to serve the whole state of Nebraska. And what they were facing at the time was the people not being able to pay rent, eviction notices, and they were supporting these tenants that couldn't pay rent because of the pandemic.
Right.
So we were able to come up with a plan for them to use COVID money or otherwise to bridge that digital divide. The one that's getting the most eyeballs and ears these days is how students can access their homework.
There you go.
But if I live in the woods in some backwoods county in Nebraska, I don't have access to a lawyer. Telehealth, tele lawyers mean nothing to me.
Right. I know there were several projects put on by like a Walgreens or CVS several years back that their bridge to telehealth was to have these telehealth offices in the Walgreens. So you would walk in, you would sit in something that amounts to something larger than a closet. There'd be a screen there with a video phone type setup, and then you can talk to a doc online, obviously elsewhere. But that's just one thing. First of all, I guess I'd have to have a Walgreens or a CVS in my town, right? But if I didn't, as many communities don't, right? I guess we're back to making the drive, right? Drive to a community, like I said, 40, 45 minutes away, and then hoping that they have time for me there. It's funny. I mean, there are so many angles to this. Our team was sitting in on a briefing yesterday, and what we were talking about was virtual phones, but an IVR system. So IVRs have come a long way. And if you have a traditional, physical PBX on site, it is difficult to upgrade an antiquated system or even a new system so that you're able to handle a volume of calls, prioritize those calls without putting other people on staff, right? And so the use case for this would be, let's say there's a snowstorm and you got a whole bunch of people calling in because they can't get out of their driveways. I don't know. Right. And so the use case is I'm going to call this phone number, and it's what many of us take for granted is there's a machine that answers that says you can wait for Jim Bob to answer the phone, or we've collected your phone number and you can maintain your spot in line, and we'll call you back in the order in which your call was received.
I love those.
Well, I do too. It gave me some time back, right?
Right.
But here's the thing is, if you live in a virtual world where you have a virtual phone system, guess what? IVR is literally checking a box on a screen and turning it on, right? And enabling a community to take care of, in the midst of a pandemic, to take care of a volume of something so that we can all sleep a little better today. A power outage, a flood, a tornado, whatever. To me, that's what we can be spending our money on. That's what we can be spending our time on. But those things are only possible or are better possible in a virtual world where we've obviously enabled them with better data, better internet services.
Well, you touch on a really good point there, Mike. When the pandemic first started, the worst case scenario was what rightly was assumed, right? That people are going to die like flies. We're going to be left with no IT department, for example. How many calls did we sit through where clients were calling or prospects were calling and saying, if my 3-person IT team is immobilized in any way, how can you guys support us?
Right.
And that applied to us too. We were like, what are we going to do?
Right.
If that's the case, but everyone's dying. Thankfully, this pandemic didn't do that, right?
Right.
There might be something else. I God forbid, right? But now we know how bad it can get or how much worse it can get.
Right.
Automation, virtualization, standardization, documentation, backup planning, disaster recovery, the basics have not changed, right?
Right.
It's no sexier than it was last year.
Yeah, for sure.
You have to do the basics right. And I think it's a great time for anyone listening, our clients, prospects, anyone, to define what those things are.
Yeah.
Chase them with the dollars available and the time you have available.
Right.
This is the right time to talk about all those things, because
Absolutely.
the next one may not be as kind to us. It's as much as destructive as COVID-19 has been.
Right.
Our plans were for worse.
You know, somebody in one of the meetings we were sitting in brought up, have you noticed that we don't seem to be talking about the flu this year, right? And it's true, right? I mean, we just look at our own extended team, you know, our clients and our people as well. And I haven't had one case of people staying home for the flu, staying home to quarantine because they've been exposed to COVID or having COVID. Yes. Right. Mm-hmm. But the flu, no. And here is why I think, or one reason why I think that's happening is we're doing the things we probably ought to have done a long time ago. We don't come to work when we're sick. We wash our hands, right? We cover our mouths, right? We make sure we do the right things to not spread germs, right? I think when we come out on the other side of this pandemic, we'll have some of those habits. Most of us will. The rest of us will go back to the way we were doing things. And guess what? The flu will come back as good as it's ever been, right? In all its glory. I think, like the flu, technology needs to be adjusting to this shift, if you will, in need. We should be looking for the opportunities to create contactless transactions that make our governments more efficient, right? And then allow us to do what? The things we should have always done. Wash your hands, cover your mouth, don't go to work when you're sick. And in doing so, we're all going to be we will be a better world for it, I've no doubt.
Right. Yeah, the basics. I think a lot of one or two that I do know, organizations were so forward thinking that they were like, we're going to take this opportunity to become contactless. Yeah, but you're running an AS400 for your ERP. How do you collect taxes today?
Right.
Oh, they mail it in or they walk it in. The gap is too far. You can't go from a green screen to Internet of Things and artificial intelligence just because you have COVID money.
Right.
You know, like I say, you have to go back and eat your vegetables. You can't just. You have to do the basics right.
Yes.
Man, on that note, I think we'll call it. The show notes will have the steps we talked about. Have a plan, do the basics right, assume or don't assume the right things,
and take time out for a little strategic planning. Right.
Right.
Invest the time in that now. Now's a great time to do that, right? Do a Zoom meeting and just everyone bring their ideas there, but do not define those with brands and products. Define those in terms of community needs. I think you're going to get there quicker.
And that's where we come in, because we don't resell.
Absolutely.
We don't. Not that we, I don't know, let's do a little sales pitch. We don't resell. But we know every brand because and you know, we know the trusted ones,
right?
For a particular use case. Anyway,
no, you're right. I mean, I like being product agnostic when we go in and we're going in and visiting with a client who's flexible, and we're trying to be creative in our application of technology. many times, maybe the only parameter is the outcome they're looking for and the budget they've assigned to it, right? But in all of that, I can come in there and, like my IBM friend, and come in there and say, here is a product that IBM sells that's going to fit your need, and here's how much it costs. Or name it, HP, any of them. Even if I was to go to CDW, who might not be product agnostic, but they certainly have tens of thousands of products to sell us, right?
Right.
Don't come at me with product. Come at me with a design, a solution, a fix for something that isn't working quite right. And from there, then let's look at your budget, your design, and let's then help you decide, maybe based on things we've seen in other, with some of our other clients, or some of even our competitors, some of the use cases that are published out there. We can help you choose, maybe this vendor might be a good place to look, but don't buy it from me. Use your government discounting, use this contract over here, use whatever vehicle you need to get the best price for the product, and we'll help you get there with a better spend. I like that we're product agnostic. Sometimes it pains me to see how the money gets spent on the product, right? But at the same time, I think there are better people for selling, and servicing that stuff than us.
Right. Awesome. All right, Mike. We'll do this in
Yeah.
a few weeks and talk about something else. But
Yeah. Hopefully see you in person sometime soon, my friend.
once you've solved the pandemic, we'll see you. All right. Thanks, Mike.
Take care. Thank you.
We have just concluded another information-driven episode of Rethink IT. Join us again next week and continue to discover how to rethink IT and implement new and better ways to deliver world-class government services. To access the show notes and other episodes, or to learn more about working with Abhijit Verekar and Avero Advisors, visit averoadvisors.com/rethink IT. We hope to see you again next time so we can continue to build a smarter government. Until next time.